of breath sounds that you are likely to hear while examining the chests of both normal individuals and patients with pulmonary disease. To hear the sounds reproduced most realistically, you should listen to the tape through a stethoscope. Be sure that the earpieces are pointing forward. Then hold the bell 2 to 3 inches from the speaker of your tape recorder. If you place the bell on the speaker, you will hear more noise than breath sounds. If you listen to the sounds without a stethoscope, they will sound unnaturally loud and booming. This phenomenon, known as the Fletcher-Munson effect, is due to the frequency response characteristics of the human ear. On some of the sounds on this tape, you will hear a short beep just before or during inspiration.